On this episode of Putting Possibility into Practice, we are talking cybersecurity and some best practices for data security in today's healthcare environment. What can you do to make sure your practice is secure and your patient's data is in safe hands? I'm joined by Larry Whiteside, the Chief Information Security Officer here at Greenway Health for this episode of Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and this is another episode of our podcast, Putting Possibility into Practice. We are talking about data security in today's healthcare environment, and joining me on this podcast is Larry Whiteside Jr. He's the Chief Information Security Officer here at Greenway Health. He's a frequent contributor not only to the content that you can find in our Knowledge Center on our website, but has hosted some webinars and rejoins me for another episode of our podcast as we've had him here before. Larry, thanks for joining me.
No problem. Thanks for having me again.
Now, Larry, we're just talking about some general data security tips that practices can take, and but first, let's set the stage. I mean, the healthcare environment. I mean, when it comes to data security, bullseye right on that industry.
Yeah, in healthcare, from a data standpoint, the healthcare record, the health record itself, is the most valuable record in existence. And it's because the data inside of a health record is so juicy and can be used for so many malicious things, just well beyond financial fraud. There's Medicaid fraud, there's IRS fraud, there's a lot of different things. So attackers, both electronically and even physically, are trying to get access to health records in any way they possibly can.
Now, obviously, here at Greenway Health, we have a number of data security protocols to follow, a lot of them federally mandated, I take it. For healthcare practices, for providers, what are the basic steps first that they can take into making sure that the security that they have on their systems is that the data that they have on their systems, is secure?
Yeah, there's some basic things, right? And it really is basic everyday practices that anyone can follow. One is lock your computer. Some people think it's cumbersome, but the reality is the amount of time that it takes to make up an excuse for why you didn't lock it, you could have locked it 5 times. It's simply pressing the Windows key and L simultaneously on Windows devices. And most people use Windows devices in medical practices. So locking your computer is important. Not locking it can allow someone to get access to your email, get access to your EHR or medical records without the proper access, meaning they're not authorized to see that type of information, and they can use that information in different erroneous ways to take advantage. So that's a very quick one. Another one is a clean desk policy. I say this one a lot because I've watched it as I've walked into my children's pediatric office, as I've walked into my own doctor's office, where you see papers that are laying on the intake receptionist desk of other patients and other patients of the practice. And there's information that I probably shouldn't be seeing as another patient, but they have that information laying around. So having clean desk policies is another good practice, because you just never know what prying eyes are watching. Somebody's HIV status or other things of people's health that is critically private to them is probably not something that you want every patient coming into the practice seeing. Some other basic things are strong passwords. In medical practices, unfortunately, sharing passwords is a common theme that I've found over the years in talking with them and dealing with them. And it's a bad practice, and I'll give a couple of reasons. We've had instances where practices have said someone logged in and prescribed medicine to some patients, and they didn't know who it was because they were sharing a password, right? Having shared passwords across multiple people doesn't allow you to hold individuals accountable for doing bad actions inside of your different technologies. So not sharing passwords and then using strong ones when you have a password so that other people can't easily guess it and use your credentials inappropriately.
And on that password point, you talk about using strong ones and not sharing them. How often should somebody change their password, for their system in a medical practice, or maybe have the rest of maybe it's their practice manager or the rest of their staff or other assistants, how often should staff be changing passwords? And some people may say, I have so many passwords to remember already. Do I really need to change it every X amount of days, months? But is there some good type of standard time frame to do so?
Yeah, so you bring up two good points. I'll deal with the time frame for changing first off. So industry best practice is 90 days, right? But personally, I say with your passwords, if you use what we call passphrases, because the entire industry has changed and the mindset has changed around passwords. If you go from what has typically been a very, very complex short password of 8 characters to a relatively complex passphrase of 16 or more characters, I think 6 months, which is 180 days, is sufficient. Because if you utilize a passphrase that is unique to you, that someone else wouldn't necessarily be able to guess, while still using some good basic password characteristics, the password is far more secure than it ever would be and needs to be changed less frequently. But an additional point you brought up was everybody has so many passwords. So one thing that I stress, and I stress a ton, is try not to reuse passwords. Reusing passwords across multiple sites, across multiple entities is problematic, because if your password gets hacked in one location, now your password is potentially hacked across every location, right? And so not using the same password is critically important in today's environment. As we've seen things like Ashley Madison and a number of other entities that are public have their password databases cracked and then posted publicly. Those things being associated with your public or private corporate email address, people then go out and start trying to use those in different areas. They start trying to use them at your bank. They start trying to use them at all of these different things to see if you're utilizing the same password string. So do not use the same password across multiple entities. And then if you are using a passphrase, and I'll give you an example. So everybody who knows me knows I am a Dallas Cowboys fan. I am a diehard Dallas Cowboys fan. So it could be a good guess that I could use something associated with the Dallas Cowboys as part of my passphrase. But even knowing that, if I were to create a phrase that says, I am glad the Dallas Cowboys cut Dez Bryant, that's not necessarily a passphrase that someone would guess. But then if I begin to add alphanumeric characters and numbers in there arbitrarily throughout that, there's other components of that then make that passphrase that much stronger. And when you have strong passphrases like that, I think you can go a little bit longer than the 90 days, and my recommendation is 180.
So for medical practices who, go through all the steps and think their information is 100% ironclad, not going to get hacked, we're not going to have any problems, what happens when there's a problem? And why is it more important maybe to be proactive and have some planning as to, in regards to, okay, when something happens, here's how, here's kind of the process as to what's going to take place?
Yeah, so the first part of that statement is we've come to realize in the industry of cybersecurity, it's not if, it's when. So we're past the stage of if I have an incident or if I get hacked. It's going to happen at some point. And so the best practice is to prepare for it. And what does prepare mean? Prepare means at some point you need to act as if the technology is not there and you're operating without it. Because whether it's a problem with the technology or a problem with power or a problem with some other aspect of it, at some point you're going to lose access to the technology you use on a daily basis. And you need to be prepared and understand what does that mean for your practice versus just shutting down. If you think back 10 to 15 years ago, for practices that have been around before the advent of the EHR, you operated, you ran efficiently, maybe not as efficient as you do today with the advent of EHR and technology, but you were able to operate as an organization. So think back to how you operated in those days with your paper processes and walk through and test those scenarios for the chance when you lose access to technology, when you lose access to whatever systems it is that you're using, so that during those hopefully short periods of downtime, you can still operate as a practice without losing revenue during that time.
Let's talk about, not only being secure, but the information that you have. I mean, I know, for example, I have, just a regular Microsoft Surface tablet. That's my regular everyday PC, but I also back it up on an external hard drive once every couple of weeks because I don't want to lose all my documents and updates that I've made, and I want to have some sort of a backup system. Is there a standard as to how often folks should be backing up servers or the information that's on their practices, computers and systems?
Yes, and this is a secondary part to the technology piece where we just talked about planning for an incident. So you have the paper process, but the secondary part is have backups. You should, on a daily basis, be doing at least incremental backups, and on a weekly basis be doing full backups, so that you have got a good copy of the information that sits on your technology infrastructure today that will allow you to recover. And I hope and pray that at least once a year you're actually taking the backups of that data and trying to restore it. You should be performing or attempt to perform restore events at least once a year, better at least once a quarter, because that is the only way that you know that your process of backing up and restoring works. A lot of organizations focus mainly on backup, and then when it comes to a crucial time where they need to restore, because they have not tested it, they have not walked through the process or procedure, they're not able to for one reason or another. Sometimes the way that the tapes were written, sometimes whatever you're writing to fails. So you should at least once a year practice not just ensuring the backups happen, but practice restoring to ensure that you've got the ability to retrieve that data and put it back on a new system.
So we've talked about backups, we've talked about passwords, changing passwords and locking your computer. What other cyber hygiene, if you will, tips can you provide practices to take on an everyday basis, weekly basis, to make sure that their data is as secure as it could be?
So one is have an antivirus. There are dozens and dozens of free antivirus, anti-malware tools that you can install. You need to be running one in your practice. They aren't going to protect from everything, but they are going to protect from a lot of things. So your goal is to at least have the easy things being able to be protected from. Targeted attacks, you're not going to be able to afford the technologies that will protect you from highly sophisticated targeted attacks. But the majority of attacks that most practices will see on a daily basis are the what I'll call the wide attacks, where it's something that's impacting everybody, and they're just trying to take advantage of systems more holistically. Your basic antivirus solutions will take advantage and will be able to stop the probably 85 to 90% of attacks that basically exist on the internet today. That other 10% is really about having good operational procedures of how people work on a daily basis. Having policies inside your organization and educating your users on what they should and shouldn't be surfing. Surfing bad sites and environments that are known to have malware, such as pornography and hate sites and things of that nature that are very malware ridden, are probably things that you should have policy and communicate to your staff, are not things you want them doing on your corporate infrastructure. So it's some really basic, just good citizen type things to teach your staff.
And as we head towards the end of the year, maybe there's some type of end of the year maintenance folks can do on their systems. We've talked about backup, we've talked about restoring, but maybe taking advantage of some of the extra free time they may have around holidays or slower time periods for their practice. Are there types of things people can do at the end of the year to get themselves prepared now for the new year?
Well, there's some actually things to be aware of. So number one, what starts happening around this time is shopping. And online shopping becomes a very big thing from a corporate technology standpoint, where users are, during their free time at work, using their corporate devices to shop. Well, attackers know this, and they begin creating sites as well as attacking well-known branded sites to inject malware into those sites. So be very wary of online shopping. Ensure the site that you plan on going to, if you're allowing online shopping inside your environment, ensure the site that you're going to is the site that you intended to go to. If you're trying to go to Target, make sure it's target.com and not target.cn. Or make sure it's not Target, where the E has the tilde over it. Those are the types of things that during these times of year tend to pop up and tend to begin existing, because attackers are recognizing that people are going out to do holiday shopping. And that becomes a very, very big threat. Attackers get very active during the holiday season, because that's when we tend to let our guard down the most.
So as this year comes to a close, probably great reasons to be extra cautious of your systems at work. Well, Larry, I thank you for taking the time to join me on our podcast today, and I know we'll get together soon again to talk about some more great cybersecurity topics.
Thanks for having me. Appreciate it.
Larry Whiteside Jr., the Chief Information Security Officer here at Greenway Health, as we talk about data security and tips that you can take as providers to protect your information in your practices. I am Joe Augustinelli, the Social Media Manager at Greenway Health. For more information on the products and services offered by Greenway Health and how we can partner with your practice, visit www.greenwayhealth.com. This is our podcast, Putting Possibility into Practice. I invite you to subscribe to our podcast on your platform of choice. We're on them all now. We are on SoundCloud, Libsyn, Apple iTunes, Google Play, Stitcher, TuneIn, and stay tuned for more platforms coming soon. Once again, Joe Augustinelli, the Social Media Manager at Greenway Health, for Putting Possibility into Practice, the official podcast of Greenway Health.